Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host of the Dean's Chat podcast. Today, we are doing our interviews from beautiful Scottsdale, Arizona, and I am joined by 4 of my students from the Arizona College of Podiatric Medicine. All are from the class of 2027, and all are only 2 months into our academic curriculum at the college. My hope is to follow this group over time and bring them back on Dean's Chat to provide educational insights as to what the educational experience is like at AZCPM. I'd like to introduce each of them individually. Zach Anderson. Welcome, Zach.
Hey, thanks for having me.
Thanks for being here. And thanks for going without the headset.
Oh, yeah, of course. Hey, I got good hair. I don't need to ruin it with the headphones.
There you go. And Audrey Diaz, welcome.
Hello, happy to be here.
Thanks for being here, Audrey. Renita Lahiri.
Hi, thank you for having me.
You're welcome. And Renita, you'll have to speak into the mic just a little bit. There you go. All right. And Austin Benally. How are you, Austin?
I'm doing well. Thank you for having me, Dr. Jensen.
Oh, you're so welcome. Thank you all for coming down here. I know you're in the middle of the week. We're here on an afternoon on a Wednesday, so thank you. So just to set the stage for our academic discussion, what I was hoping we could do is get each of you to give us your podiatric journey to date. So I was thinking perhaps where you're from, where you did your undergraduate work, and then also, how did you find out about podiatric medicine? Renita, you want to go first?
Yeah, sure.
Pull that towards you just a little bit. There you go.
So I'm originally from Washington State, and I did my undergrad at the University of San Francisco. I majored in kinesiology and minored in chemistry. For me, the podiatric journey began from, my brother, because he was actually in podiatric medicine school, the same exact one, actually. So he helped introduce the whole field to me, and then through that, I was able to explore it more and then shadow a podiatric surgeon and then kind of just like look at what he did, and I really fell in love with it and I wanted to go deeper into it.
Well, we're glad you chose the Arizona College because your brother just graduated in May.
Yeah.
And I know he's doing well in residency, so thank you so much. Audrey, would you share your podiatric experience to date?
Of course. So I'm from Dallas, Texas, and I went to Baylor University. I was a biology major, and so everyone just kind of said, okay, so be pre-med. That's what you do whenever you're a biology major. And I continued with that, but I wasn't really feeling a strong pull to any specific place in medicine. And so I did an internship in medical device sales, and we actually had some foot and ankle plating systems where I met some really great podiatrists, and I started shadowing, and I just realized that I was so passionate about it, and it made me really excited again to take the MCAT and apply and go to school.
Fantastic. My son went to Baylor. That's a beautiful campus down there.
It is.
Fantastic. Well, thank you. Thank you so much. And Austin Benally. Austin, welcome. Can you share your journey? You can pull that mic towards you if you want. There you go.
Yeah. So my journey is kind of atypical, I would say. I grew up surrounded around podiatric medicine. My father went to the California school. So when I was probably 2 to 5 years old, I remember seeing him go through the whole journey, and I got to grow up with that. I was surrounded by the entire world of podiatric medicine, got to see him go through residency. So I had a familiarity with the profession. So going into college, I knew I wanted to do something in medicine, so I just picked a pre-med major and pursued biology. And throughout that time, I was able to shadow a few podiatrists, and I got to see how they loved the field, just like my dad did. And it really showed me that it could be a great field for myself. So, yeah.
Fantastic. What year did your father graduate from CCPM?
That would have been 2004.
2004. All right, very good. I went to CCPM, but I graduated a few years before that. 1991.
Okay.
So Zach, welcome. Tell us about your podiatric journey.
Yeah, so I wouldn't really say mine's atypical, but I'm trying to be a first-generation physician in my family, so I didn't really have like any familial things to get into the profession. But I was a college athlete for my undergraduate, so I'm from Chandler, Arizona, and then I went and played college basketball at Missouri Western, which is a school in St. Joseph, Missouri. Shout out the Griffins. And then, being a college athlete's a full-time thing. I mean, from January, the whole year I was booked, but over the summers when I I had about a couple months off, I would come back and start shadowing physicians. And so it's funny, actually, the most recent guest of the Dean's Chat podcast is Dr. Jason Case. So he was the first podiatrist that I shadowed here in Paradise Valley. And so he's kind of the reason that I liked podiatric medicine a lot, because, I went and shadowed him for a couple of weeks and I was like, oh, this is awesome. Like, just the hands-on, you get to be with the patients, the effectiveness of podiatric medicine is awesome. And so I think just shadowing him and led me to AZCPM. So it was awesome.
Fantastic. One of the common themes that we see with students that are enrolling in any school of podiatric medicine is that shadowing opportunity. So I know Dr. Case well. I mean, you had a great experience, and you were with your father. Renita, tell us about your shadowing experience.
So I actually shadowed the smaller little podiatric clinic. He actually had his own private practice, and he kind of just helped me through the entire thing. He would show me like everything he did during his medical school to prep me for that, because it is a big thing to get from undergrad to medical school. So he made sure not to hold anything back, and he told me like everything that went wrong in his schooling and what he wished he did differently. So having that, as well as just seeing what he does in the office, was amazing.
Do you mind sharing what he said to you about what he would like do differently?
And get a little closer to the mic, Renita. There you go.
So he shared that it was just very stressful, and he had a lot of anxieties being able to get through everything that he needed to, because again, like, we have tests every week. So to be able to prepare for that and just know everything and be able to feel comfortable about that, it's just so much stress. So just having like the materials needed to be able to handle that stress is very important. So he kept me prepared for that.
No, that's great. And Audrey, who did you shadow, and what was your experience?
I shadowed a podiatrist, Dr. Settle, in Texas. And what I really loved is that she had such strong relationships with her patients. And she kind of like picked up the conversation where they left off last time. Like, it was always like, oh, I know you were going on this trip. And I just loved how much her patients just loved her, and they were so appreciative of all the care and relief that she provided them. So that really made me excited.
Oh, that makes sense. And then Austin, with your father being a podiatrist, I mean, you knew everything about podiatry inside and out. It's not uncommon in our profession to have legacy. We call us legacy students, students that come in and their parents are podiatrists. And I think that's fabulous, because a parent's going to recommend the very best for their children. So I'm glad you chose podiatric medicine. Well done. So my next question for each of you is, if you could just say one thing, one reason why you chose the Arizona College of Podiatric Medicine, what would it be? Austin.
For me, a really big part of it was location. I didn't feel like going to the East Coast. I'm from New Mexico, so literally right here, and I also went to college here, so I was familiar with the area.
Oh, that makes sense. Very good. And then Audrey?
I think that I chose it because there are so many different kinds of professions at this school. And I thought it's just such a unique experience to be in a place where they have vet students and DO students and OT students. And I thought that was really unique.
Yeah, the interprofessional experience is unique. There's no doubt. It's really it's a vibrant community of healthcare professionals, for sure. Renita, what was one reason that you decided to come to the Arizona College?
I think the biggest part would be when I took my interview here and like talked to the professors, it really seemed like such a good family because of the class sizes being so small. Like, we only have like 41 people this year. So it's just a really nice community to have.
Absolutely. And Zach?
Yeah, I mean, I'm a numbers guy, and so the AZCPM numbers doesn't lie. I mean, their residency rates, their test scores. So when I was going through my medical school journey, I saw that, and then came on during my interview here, and I was like, I don't think there's a better place for me to go. So I think that's definitely a big reason that I'm here.
Very good. So I know time flies, and I know you're 2 months into the process, but if we were to vault back 2 months ago, you all came to Phoenix, and you got your situation set up so that you were ready to go and study hard. What was it like to come in for orientation? And were you feeling some free-floating anxiety about the task at hand and the academic rigors at hand? Audrey.
I was definitely very nervous. I just had no idea what to expect. And some people would say, oh no, it's going to be okay. It'll be fine. Just study and you're going to be okay. And then other people would say, oh no, like this is going to be really, really bad. So I just had no idea what to expect at all because everyone says different things. So I was definitely nervous.
No, that's fair. I think most people are nervous. How about you, Zach?
I mean, I wasn't necessarily nervous. I was just excited. I learned a long time ago in basketball, if you learn how to take your nervousness and turn it to excitement and confidence, then you're just super successful that way. So that's always been a big foundation for me. So I was just ready to get excited. I mean, you dream and work so hard to become a doctor. And it's like, now that it's finally started to get going, because like an undergraduate, you don't really have any any gratification of saying, hey, I'm doing really good to get to this. But then right when you're in medical school and you start, doing good on tests and stuff like that, you're like, like the ball's starting to roll. You're almost towards treating patients. So I think you just got to approach it with confidence.
That makes sense. The other thing about that, Zach, is when you're an athlete at a collegiate level, you become good at time management. I don't know if that helped.
Yeah, I would definitely say, I'm a super schedule-oriented guy. So, I know what I'm studying lecture 36 and then going back to 2. So it's like, I think the good scheduling, like you said, from being a college athlete, from having to wake up at like 6 a.m. for practices and then going to class. But yeah, that's a great point.
Okay, very good. Renita, what was it like for you when you came on for the first experience with orientation and try to get really close to the mic? There you go.
So I definitely was really excited to just meet everyone because that was my big thing. I just love meeting people for the first time and like making those friendships. But then like I definitely had a lot of that anxiety because I don't fully know what I'm going into. I don't know if I'll be successful. I know I have to work really hard to get there. So it's just like a lot of mixed feelings.
Well, that makes sense. But I think it's important to realize that that's normal, right? Everybody feels like that because it's going to be a lot of information. You're just not sure if you can assimilate it soon enough. And then all of a sudden, a week after you started, you had your first exam. So that makes sense. Austin, what was your experience coming in?
Yeah, so I definitely had an expectation of what it was going to be like. During undergrad, a lot of my professors, most of them were MDs and PhDs, so they were pretty real with us. They would tell us grad programs, it's like drinking from a fire hose. And it's accurate, it's true, but you acclimate to it. And definitely after that first week, I found that, once you get into the groove of it, it really is more manageable. And another thing, as you were saying, Zach, working towards a lifelong profession of learning is really rewarding and exciting. So every day, you're working towards that. It's definitely a process. There's not necessarily, you shouldn't be looking for the end goals for everything. It's always growing and that constant process. So yeah, really, really exciting.
No, it is for sure. All right, then let's move into the quarter. And really, if you think about it, when we're having this discussion, the people that are going to be listening to this episode are going to be students that are going to be coming in next year and your classmates and everybody. So just for our listeners, when we start the first quarter here at the Arizona College of Podiatric Medicine, we have 3 courses. We have Pod Med, which is really more of a fun course, finding about the profession. But the 2 courses where the rubber hits the road right away is Biochemistry and Anatomy. Would each of you mind just talking about how you have navigated that so far and different study techniques that you found that have worked for you, and even perhaps study techniques that you've abandoned that really didn't work for you? Renita, would you like to go first?
Yeah, of course. So basically what I found is that studying in groups was very helpful for me. I just need to be around people to be able to study effectively. I just like having that social aspect because it helps make the studying not be boring.
Sure.
Because as much as I do love learning about this, it's a lot of content, so it can get overwhelming. And just having that environment is great. Whereas studying techniques that I've abandoned, I think it's just rewriting the notes because personally for me, it has not worked well. Whereas I know for other people it works really well. But it's just learning as you go.
Very good. And do you go to class or do you listen to the basic sciences on rerun or faster speed? Or how do you do that?
So I go to pretty much every class unless I'm just not able to go because I have too much work. But I think I've only skipped like 2 or 3 classes.
Very good. And how do you like your Pod Med course?
Oh, that's my favorite class. Just being able to talk with everyone. We're just playing around in the lab, and it's just so much fun.
Very good. Well, I guess I'll ask each of you, what's your favorite part of that class so far?
I definitely feel like I really enjoyed our last class where we did a lot of the padding because we kind of got to pick an injury to do the padding for, and it just felt like it's something that we would do a lot in the future, and it was just really fun to be able to do that with our friends.
Very good. And so you've acclimated well. Zach, what do you think? The experience coming in once classes started.
Yeah, I mean, you kind of just get into the groove of everything. Like Austin said, I mean, you figure out what works for you. And I mean, what works for me is, I mean, the professors at the school do a great job of providing us the notes and making sure everything's in a table and nice and clear. So I honestly just sit and read the notes. So, I mean, I like to do that. And then with the PodMed stuff, I mean, I love like anatomy. Anatomy is my thing. And so we haven't quite done a lot of lower extremity anatomy in our main class, but in our PodMed course we have. And so I think that was awesome. Like going in and then actually seeing like, hey, on you and on your lab mate, this is your hallux or whatever. So it's like, I thought it was really fun.
So you said you kind of get into the groove, but what does that mean? I mean, like, what does your daily routine look like for studying?
So, I mean, I try to do at least like 4 hours in the morning and 4 hours at night. I mean, I try to go to every class, but like Renita said, I mean, sometimes you just can't because you have a test coming up. So you have to learn how to like divert time to certain classes other than, so, I mean, what was the question again? Sorry. What was the
I was wondering about your routine. You said you get in the groove at 4 hours in the morning.
Yeah. So, I mean, it's just, you kind of just depend on what test is coming up, right?
Yeah.
So I think for your first semester, the big thing is just learning, hey, this test is coming up earlier. I need to spend 75% of my time doing that and 25% on the test that's next. So it's really just diverting and learning how much time to spend on certain subjects.
And that's not easy to figure out immediately. It comes with time.
For sure.
Okay. Audrey, how about your experience for studying, and what have you found that works, and maybe what are some techniques you may have abandoned?
So I'm kind of similar to Renita in the way that I love studying with groups. I feel like there's so much information, and sometimes it's easy to look over little things on slides. And so whenever you have your friend ask you a question about one little thing on a slide, and you just realize, oh, I've never even seen that before. Okay, so thank you. And but the thing is, I do love writing the notes. I write every single thing down. I know that Renita doesn't like it as much, but it is my favorite thing. The thing that did not work for me, though, was Anki. I didn't really like the fact that it was kind of information in isolation. And I feel like a lot of the things, at least for me, is that I have to kind of understand it in a big picture instead of just seeing one little vocab definition, or just whenever they kind of take out one word, I have to see everything on the slide together. So, but I know a lot of people love Anki. I think part of it is just that I never figured out how to make my own Anki decks, so that was definitely a deterrent for me.
Fair enough. Well, what do you think about PodMed? What's been your favorite part about the PodMed course?
We did have a lot of fun with the last one. That was the taping and the padding, and we were all there cutting out little squares and taping them onto each other. And so honestly, that was probably the most fun one. So I agree with Renita.
Very good. Austin, tell us about your study habits and what you've done to be successful so far.
Yeah, so I've used Anki a lot, especially on the MCAT and in undergrad. I used it for organic chemistry. I used it for biochemistry, molecular biology. So I was pretty familiar with it. So I've used it a lot. Coming into AZCPM, my second year big provided me some decks, and I've been using those a lot. Sometimes to supplement them, but I really like that, but I only do them after I've rewritten the notes.
Oh, so you're a rewriter too?
Yeah, I kind of do a hybrid method. So I like to map out all the concepts and ideas, and then I cement everything with Anki. And then also sometimes meet up with a group too, because it's great to hear other people's views on the information, and sometimes it'll just help something stick.
You know, it's interesting because some of us are auditory learners. Some are visual, some are tactile, writing notes. You can tell what I am. I've got notes. I learned a long time ago, if I write something down, I'll never forget it. But if I just read it, sometimes I do. So everybody's different. And I think that's important to realize, that students have to realize what works for them and then repeat that. And it truly is. Over the next couple of years, you'll find that it's rinse and repeat. It's a different course, it's a different material, but the concepts and your ability to retain it and then answer questions on a test remain the same. So that's outstanding. So what's it like here at the Midwestern University being in the same class with the DOs? I mean, between 40 podiatric medical students and 140 some DO students. How have you found that? Do you enjoy that, or or what's been your experience, Zach?
Yeah, I think it's good. Dr. Curtis brought up a good point in our last pod med class is that, before we can learn to be podiatric physicians, we have to learn how to be physicians. So I think being mixed in with the DOs and kind of getting that same education is really good. And it also helps us for communication. Like with podiatrists, that's like it's cumulative care of your patient. So you might have to talk to their primary care provider who's not a podiatrist and who maybe is a DO. So I think it's kind of establishing good communication techniques and just overall being able to communicate with them.
I agree. Austin, what are your thoughts on being integrated with the DO program?
Yeah, it was honestly a big part of me choosing a school because I had also looked at Western too because I know they have very similar curriculum to us and they integrate courses with DO students. But I think it's great because it promotes parity. It's promoting communication, the interprofessional disciplines, and it's nice talking to them too because sometimes I'll ask them, like, what specialty are you interested in? It's fun to talk to them. And then they'll ask, why podiatry? And then I can share with them about that. And it's really neat just to see everyone working towards a common goal of helping our patients one day.
Yeah, I always find it's interesting because our students get study groups that are mixed with podiatry students and the DO students. And I think it's interesting because the professors don't even realize who's in what program, and our students just do so well. So I think it's good. I don't think there's any downside to it, to be honest with you. Audrey, what's been your experience with the interprofessional relationships?
I've really enjoyed it, and I think that the class size that we have for our lectures is a really good amount. I feel like 40 maybe would feel a little bit small for all of our classes, so I like being in the big auditorium and lots of people, and then for our lab groups, we're also with the DO students. And I really enjoy talking to them. So it's nice to have lots of different people from different places and who are interested in different specialties.
Very good. And Renita?
Yeah, I feel like the same for everyone. I really love taking the classes with them. I've made so many friends, and it's just, you realize how different it is at the same time because they're taking OMM, and then sometimes they'll like crack your back for you, which is a really nice thing when you're sitting in the auditorium for 3 hours during lectures.
Oh, very good. That's a good point. I'd love your comments on this fact. 48% of MD and DO students get their first choice in residency for specialty, and 76%, I believe, get one of their first 3 choices. How impactful was it coming into podiatric medicine, knowing from the beginning what your specialty was going to be? And did that play a factor in your decision, Zach?
Yeah, I mean, that's a good question. I mean, I think definitely it allows you to learn more about your specialty at an earlier stage in your education. Because instead of learning about the whole body, while we are learning about the whole body, we get to know how it applies to the feet and everything in the lower extremity. So I think it's definitely a big thing, and it was a reason why I chose to be a podiatric medicine, because instead of not necessarily just being a generalist, but allowing to be a super specialist with everything in the lower extremity, I think was a big factor for me becoming a podiatric physician.
Yeah, I ask because I'm hearing that from students as they come through the interview process, that they love the fact that they know what they're going to be in the gates. Renita, what was your experience with that?
Yeah, mine is pretty much the exact same. I like being able to know what I will be doing as well as start really early as well, because as much as we are just going to the introductions in our PodMed course, it just sets the stage of what we're going to be doing for the rest of our lives. And it's just really nice to know that I'll get into a residency in this field and just be set in my path.
Well said. Well said. Audrey?
Yeah, I definitely totally agree with all of the things that have been said. But additionally, I think it's so fun that all of our classmates, I know that they're all going to be podiatrists. And I think that's so exciting.
It is. Like we talked about in orientation, everybody that you're sitting with today are going to be friends for the next, 40 years, going to meetings together and reminiscing about the old days of taking biochemistry. There we go. Austin, what's your experience?
Yeah, so I love knowing what I'm going to be specializing in because I can really put a special emphasis on things. We've had a few recent biochemistry lectures on diabetes, and it's the bread and butter of podiatry. So it's really neat to start really early on, start integrating all these concepts, and definitely work towards becoming the best physicians we can be.
Absolutely. What do you think is going to change as next quarter when additional courses are being added to the curriculum? I mean, is it same thing, same program, or are you going to have to study more or shift gears a little bit? Have you given it any thought yet? Audrey?
So thank goodness I'm really not that nervous about it now, I feel like, because I feel like the professors have really shown that they're looking out for us. They're going to have everything on those lecture slides. They really want us to do well. And so I'm totally assuming that it's going to be the same way and that I can use the same study tactics, because I even feel like the way that they kind of do exams is very similar across the different classes.
So we've kind of lost the fear of the unknown. Renita, do you feel the same way?
Yeah, I feel pretty much the same way about it, because definitely when I started, I felt a bit overwhelmed because of the immense amount of content we were being given, and then the fact that we had a test coming up. So just being able to know what's coming, I know how to better prepare for that, and will hopefully lead to a really good quarter next.
There you go. Austin, what are your plans for next quarter? Will they change?
Yeah, so I'm probably going to be pursuing the pretty similar structure that I'm doing right now. I'm really excited for physiology because we get to start implementing some of that anatomy into like disease or processes of the body, and kind of start integrating everything and work towards, just understanding everything a little better.
No, that makes sense. Shifting gears just a little bit, all work and no play is not the answer, right? So what do each of you do between exams to kind of recharge your battery and get ready for the next round of studying? Renita.
So basically, my main weekly schedule is we typically have our exams on Monday. So every Monday afternoon and night, I don't study at all. I just spend time with my friends and we just do nothing. And it's just really nice to not be studying and looking down at our notes for once. So I just try to take that one day to just de-stress and not worry about school. And I found that that's been really helpful.
Very good. That's great advice. Audrey, what do you do to recharge the battery?
So I also use Mondays as my recharge day and hang out with friends, but also I've kind of gotten into hiking recently. We don't have very many mountains in Dallas, so it's been really interesting to go hiking. That's just never been a thing that I've really been able to do.
Where have you gone?
I have gone to Papago and then Pioesta.
Very good. Very good. Yeah. For those listening, we're nearing the end of snake season, so you got to be careful, but they'll be going away here pretty soon too.
We did see a really big rattlesnake the other day, actually, whenever I was out with my dogs.
Yeah.
At the one by campus, Thunderbird.
Yes.
That one, yeah, really big rattlesnake. It was crazy.
Yeah, that's a good way to get your adrenaline flowing, seeing a snake, for sure. Austin, what do you do to recharge the battery?
So normally I would be fly fishing, but it's pretty far. I either have to go to Sedona or Payson. Okay. So hopefully over fall break I'll get out.
Very good.
Recharge. But I do a lot of mountain biking here. So I tend to ride over at Dreamy Draw in the South Mountain.
Very good.
Really nice.
Yeah, that's great. There's so much to do in Arizona, and really, the weather is outstanding, except for those 3 hot months in the middle of summer. But that's okay. As long as you get out early in the morning, you can get it done, for sure. Zach, how do you recharge your battery? What do you do?
I mean, I think physical fitness is the best, whether it's going to a gym, just going outside and running. I mean, another great thing about Arizona is that even though it is a little hot, there's never a winter. So you can go and be outside every time, just getting the good rays from the sun, if you're running or if you like to go to the lake. We didn't have a test a couple Mondays ago, so we all got out and rented a boat at Lake Pleasant.
I heard about that.
Yeah, so that was really fun. That was a good way to recharge. So it's really just finding time because, again, I mean, you can't necessarily study for 24 hours. As much as I'd love to do that, you have to find ways to, like you said, recharge the batteries. And so I think whether it's hanging out with friends or physical fitness, that's a great way to do it.
Oh, I agree with you. All the things I wanted to talk about, we talked about. And I just wanted to see, would you all be amenable to coming back every couple months and doing this again and giving an update?
Oh, I think that's a great idea.
That would be really fun.
Right on. Well, that's the plan. Well, I do want to thank each of you for taking time out of your busy schedules and coming down. You know how to get here now. So
of course.
It'll be easy.
Beautiful Scottsdale.
There you go. And also, you all have your Dean's Chat cups. So I wanted to let everybody know. Cheers. Thanks for joining us.
Thank you.
To all of our listeners out there, thank you so much for joining us. If you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. If you're watching on YouTube, by all means, become a subscriber. And until next week, cheers, everybody.